Hi, my name is April Morris. I'm a family nurse practitioner, and I've specialized in liver disease for over 16 years, as well as endocrinology or diabetes health for several years. So today, some questions that have come up about MASLD, MASH, and type 2 diabetes and medication management. And so the individuals with type 2 diabetes are at a higher risk of developing MASH because both conditions share similar risk factors, such as insulin resistance and obesity. And so it kind of goes hand in hand. And always with fatty liver disease or MASLD, we, always tell patients, if you get your diabetes well controlled, which is the number one reason why this fat development can happen and liver fibrosis can happen when we look at MASLD and MASH, then your liver disease will be much better controlled because of the same risk factors. And so weight loss, lifestyle modifications, making sure their A1C is under very good control really does help both conditions. And so they are higher risk because their risk factors are very similar. And so I'm discussing the effects of standard type 2 diabetes medication classes on liver fat, inflammation, and fibrosis. The good thing about it is, as sort of the previous question about, type 2 diabetes and fatty liver disease, the risk factors are the same. So things like GLP-1s, the Semaglutide and the Tirzepatide, some of the other classes are great because weight loss is a great side effect of those. And also dropping the A1C, which is also great for the liver. It actually causes less stress to the liver, reduces inflammation, and improves their liver disease. So diabetes management should never, sort of be restricted with medications because of their liver disease, unless they have very advanced liver disease, which we'll talk about in a minute. You want to make sure that their diabetes is as well controlled as possible because our risk factor for liver fibrosis also goes down. And not just, we know that GLP-1s improve or prevent cardiac events, and there was less cardiac events seen in the GLP-1 group. Their renal impairment actually was less in the GLP-1 groups as well. So, helping the liver, helping the kidneys, helping the heart, all of those things with things that we also treat for type 2 diabetes. So you don't want to restrict or, stop or not treat as aggressively as you should to get that A1C down. And so the next question, how should APPs approach medication selection for type 2 diabetes management in a patient with coexisting MASH? Considers both glycemic control and potential liver benefits or risks. You want to make sure if they have, and this kind of goes along with the last question, you want to make sure they have advanced liver disease, risk for lactic acidosis. That's the one reason why metformin should not be used. But when it comes to GLP-1s, when it comes to things like the SGLT2 inhibitors, even metformin, those are the things absolutely can give benefit to the liver as well as benefit to their diabetes control or insulin sensitivity. And so you want to make sure that you are prescribing as APPs, looking at the whole picture, big picture, and what can best sort of benefit the patient for their liver, which is sort of I always say, you fix the metabolic, conditions, you also improve the liver and reduce the stress on the liver. So those go hand in hand, and really considering what is the first line therapy, whether it's metformin, if they can tolerate that, or, of course, insurance companies can dictate sometimes what we can and can't use, but you do want to consider those patients with MASH and MASLD, especially MASH. You probably want to be more aggressive than, okay, your A1C is 8%. That's not bad. Yeah, it is. And you want to get it to that target about 7% if you can, if they're type 2 diabetics or patients with type 2 diabetes. And then the diabetes medications you want to consider and be careful of with advanced liver disease, metformin is one. But again, you still want to use that. But if they are at risk, and you do want to avoid if they're increased risk of lactic acidosis, which is the potential dangerous buildup of lactic acid in the body, and so it really is not considered harmful. But those advanced decompensated liver disease patients, you do want to be careful with that. So this is my spiel or my take on, those medications when we're dealing with type 2 diabetes and also having MASH and MASLD. Bottom line in the big picture is getting their type 2 diabetes well controlled will absolutely benefit the liver in so many ways. And that is the number one reason that, liver fibrosis can progress if their metabolic disease, especially type 2 diabetes, is not well controlled. So the medications like Semaglutide, Tirzepatide are also beneficial to the liver and using it for liver disease when they have type 2 diabetes. So thank you very much. I hope y'all have a great day.